Good morning, everybody, and welcome back to your late edition of your Lunch Break Live. My name's Ivana, if you are new here, and we are coming on a little bit later today because if you've been paying attention to the news, to us, or any other local news this morning, you might have seen that Governor Ivey held a press conference at 11 a.m. where she gave an update, we can say, on the coronavirus situation and actually announced some changes, I should say, to the state health order that will go into effect on Friday when our current order expires. I'm here to recap all of those changes with you. I have our own kind of turned coronavirus reporter, Dennis Pillion, on. He and I are going to detail the changes for you and let you know what you should know come Friday at 5 p.m. If you have questions, drop them in the comments. I'll be watching up at my phone here as well if anybody sends their questions in via social media. So, Dennis, let's get right to the meat of this. We know that the governor and Dr. Scott Harris held a press conference. They talked about a lot of different things we'll get into, but essentially, they talked about the current Safer at Home order ending on Friday, April the 9th at 5 p.m. and the new Safer Apart health order beginning Friday at 5 p.m. Now, I've got my notes in front of me and we can talk about the points of that. But Dennis, can you kind of give us what that means for just the average Alabamian?
Yeah, I think the biggest takeaway is that things like, having to wear masks in public and having to maintain 6 feet of distance, they're going from being things that are required by the state to maybe decisions that are going to be up to individuals or businesses or even cities. Governor Ivey kept using the phrase personal responsibility and common sense. She's saying the state is not going to mandate these things anymore, but some businesses certainly have the freedom to do that if they so choose, and some cities also have the freedom to implement their own mask mandates, as we've already seen with Birmingham and Montgomery, and probably some other cities will be doing that as well in the coming days.
And something interesting to note here is that while the restrictions imposed by that Safer at Home order that we have been under in some form or fashion for about a year now, the only restrictions that will continue after Friday at 5 are in regards to hospitals and nursing homes or senior care facilities. It seems like, and again, Dennis and I have been going over this document just over the last 15 minutes or so since that press conference ended. It seems like all those other requirements for businesses like restaurants, bars, et cetera, those are all turning into recommendations. Is that what you understood, Dennis?
Yeah, that's correct. And, the state health officer, Dr. Scott Harris, and Ivey were asked questions during the press conference today about, what are the actual legal requirements? What are the hard and fast mandates now after this new order takes effect? And they said that the only ones they mentioned were for nursing homes and for hospital visitation. Those settings where you're going to have people who would be really, really at high risk for a bad complication of COVID during an outbreak. Those places are still going to have rules put in place by state law. But all of the other places throughout the state, that would be churches, restaurants, bars. Those are going to be up to the individual business owners to decide, and up to maybe the cities or the municipalities where they're located. Now, Governor Ivey did say, she is strongly encouraging people to be vigilant and to keep protecting themselves from this disease because it is still out there. We're still having hundreds of cases per day pop up in the state. So it's not that the threat is gone, but the idea is that with the vaccination program proceeding as it has, and, frankly, with just the number of people who have got some kind of immunity, some kind of protection from COVID from actually having already had it, the situation is getting better because of those two things.
I'm looking through all of your comments here on the side of my screen. And I got a comment about this coming order that's going to start on Friday, April 9th. And that is, again, our Safer Apart health order. That is different than the Safer at Home order that we've been under in various iterations for about a year. And the new Safer Apart order starts on Friday at 5 when the other one ends. That is going to go through May the 5th at 5 p.m. I have somebody making a comment saying, so their common sense is going to expire 5 p.m. on Friday, May the 5th. And, that is a good good question is we don't know what this means for that May the 5th, 5 p.m. date, because as you mentioned, Dennis, there's really only two big requirements that are going to be enforced starting on Friday, and that's for nursing homes and for senior facilities. And those, if you missed it, and I'm looking at my notes in front of me, hospitals and senior care facilities, assisted living, nursing homes, et cetera, they are allowing 2 caregivers or 2 visitors. So that is the requirement under that order that is going to continue through May the 5th. May the 5th, we don't know if that will change, but that's the one that's going to continue. As Dennis said, a lot of those other restrictions we've seen for restaurants, for bars, for other different businesses across our state, those are pretty much all drop to recommendations unless a particular business or the city which that business is located in decides to come up with their own mandate or their own ordinance. So let's go over these recommendations the governor mentioned. She recommends 6 feet apart from people who are not in your household, wearing a mask or a face covering, staying home if you're sick, washing your hands or sanitizing your hands, not touching your face, sneezing or coughing into an elbow or a tissue and not into the air, to disinfect surfaces frequently. Those are her recommendations. Things that were previously a requirement, talking about the, especially the mask ordinance here, the 6 feet, those are now dropped to recommendations. So Dennis, does this mean we're going to see some of our kind of favorite places, favorite concerts, et cetera? Are these going to be able to come back full force and not have to, if a business doesn't enforce things and if they are not located in a city such as Birmingham or Montgomery that requires masks or other requirements, can they just have a free-for-all if they would like to?
I think that there is no, unless the city steps in and sets a law, there's going to be no legal reason why they couldn't. I think what we're actually going to see is just, it's going to be a wide range of businesses and cities and all of these smaller entities kind of making these individual decisions about what's safe to do, what's responsible to do. I mean, I don't think nobody wants to host a super spreader event, right? Nobody wants to be, the reason dozens or hundreds of people get sick, but it's going to be up to their own sense of individual responsibility as to whether that happens. Another thing we should mention is that the quarantine requirement in the order is still effective. So a person who tests positive for COVID would still be required by this order to stay home until they've recovered.
That's a good point. Those quarantine
I think
requirements.
That's pretty common sense, and I think most people would do that anyway, but it's in there.
That's right. The quarantine requirement stays the same. And something that they also mentioned in this order, not necessarily a requirement, but I know that especially pre-COVID, a lot of us, myself included, if you didn't feel great, you still usually went into work. And I think that is something now in this age of coronavirus, we all think about differently. And that was something that she mentioned in that order, was staying home if you feel sick. Even if maybe you don't know that you have coronavirus or you don't feel like there's a reason to think you might, stay home and do not risk infecting other people. I'm looking through again some of these comments in Birmingham's mask mandate, and Dennis might know more about Montgomery's, but Birmingham's mask mandate, the mayor said, I believe it was yesterday morning, that Birmingham police will not actively enforce that mandate unless they are called by a business or for some other type of disturbance. And in that case, they will respond, but they will not go around just ticketing people for not wearing a mask, according to the mayor yesterday. Now, Dennis, this is a good question. Our schools, universities, colleges, or our high school, middle schools, et cetera, do they have the power to require masks in their school, even if their city is not requiring them?
I would assume the answer to that is yes. I know we've certainly seen a lot of places doing that, and individual businesses and schools and places have a lot of freedom to set their own rules. If a school can set its own dress code, I don't see why they wouldn't also be able to require masks. One of the interesting things that we've seen, not so much in Alabama, but in other places, are universities kind of saying that they might require vaccination for students to return in the fall, which would be kind of an interesting separate issue, and we'll have to wait and see how that shakes out. But interesting comment here too from Edward. He says, since Birmingham has announced their mask mandate, if
an event comes to the BJCC, like the auto show, will I have to wear a mask? Edward, I'm going to say yes. I'm going to assume that is yes, because Birmingham did announce their mask order yesterday. And technically it went into effect yesterday, but it doesn't really matter for most people until Friday when that superseding kind of state mandate ends. So if you are going to an event in Birmingham, if you're going to a business in Birmingham, the city limits of Birmingham, which the BJCC is in, yes, you're going to be required to wear a mask. And keep in mind, you can go to a business. It doesn't necessarily have to be in Birmingham or in Montgomery or in one of those cities. And the business can still require you to wear a mask when you enter. Interesting fact here from that press conference, Dennis, and I know you saw this as well. The governor's office actually sent out pre-made graphics and posters that businesses can use in their windows. You might have seen some on the doors of some of your favorite places that say, you know, masks encouraged, or some even say masks required for those businesses that decide to do them. Interesting comments all the way around here. We've got people on both sides of the issue, as we've seen throughout this entire 13-month period. But Dennis, one thing I think is interesting is those of Alabamians who have been to a restaurant to eat in have maybe seen some places. I know one of my favorite places in Birmingham does it. They have almost plastic dividers between tables, but there is nothing in this new order starting Friday at 5 that requires there to be any sort of plexiglass or any sort of plastic or any sort of barrier between tables. There is, again, a recommendation on 6 feet apart, but there is no requirement.
Yeah, I think a lot of businesses are going to have some tough choices to make in the weeks going forward, you know, not just because of complying with a state ordinance or complying with the law, but a lot of people out there don't want to go places if they feel like they might get COVID. They're not going to want to go to bars and restaurants because they feel like there's a chance they could get infected. So these restaurants are going to kind of have to choose between what measures can we put in place to make people still feel safe and still want to come visit our business without being, you know, too restrictive. And, you know, they're going to have to kind of find a line, I guess. There was a story we had on AL.com this morning by William Thornton about kind of how businesses are kind of going to navigate that choice. And there was a survey conducted, and a lot of them just said they didn't know. You know, they didn't know if you know, keeping a mask mandate would help their business or hurt their business. They didn't seem to be willing to predict or to know what might happen either way on that. So there's going to be some tough choices going forward.
Mm-hmm. Absolutely. And there is a question here saying, did the governor answer a question about her stance on vaccine passports? That is a no. The governor did not answer or make any comment about that. Here's what was said about vaccines. This primarily came from Dr. Scott Harris. He very strongly encouraged Alabamians to get vaccinated. If you want to, you can go back and watch that video. We have it here on our Facebook page, and you can see his exact words, but he very strongly encouraged vaccines. He said he, his wife, and his adult children have been or are in the process of being vaccinated. He also said that the state has received more doses of vaccines this week than ever before. And a really interesting comment that Dr. Scott Harris made that I thought was interesting was saying that the first several weeks of the vaccination process, Alabama wasn't doing great. He said, though, that in the last couple of months, Alabama has really ramped up the vaccine process. And he said that if you look at these national charts and you see Alabama very far behind on those vaccination charts and the vaccination rate, he said that is why, because we got a really slow start, but that we're doing all right now. And he seemed to be encouraged by that. Dennis, do you have anything to add on that vaccination rate?
Yeah, I mean, I think certainly we are receiving more doses than we ever have before, as he mentioned. You know, a lot of the problem earlier was kind of just we're only getting a finite number in, and you know, we probably could have gotten it out faster, but really it was a limitation of supply. We're starting, he said today, there are more than 700 locations in the state of Alabama now where you can get a COVID vaccine. So we're starting to see that turn on its head a little bit. You know, everyone who is 16 and older is now eligible to receive the vaccine. There are more places than ever where people can get it. And now we're right almost at 1.2 million people in Alabama have received at least one dose of the vaccine. Some of them still have to go back and get their second dose, like me. But that's about just a hair over 30% of the adult population of Alabama now has received at least one shot.
Mm-hmm.
So at some point, as Dr. Harris has said, we're going to kind of reach that tipping point where all of a sudden it's not about meeting this demand of all these thousands and thousands of people who want the vaccine. It's going to be kind of reaching all these pockets that we haven't gotten to yet, and people who are maybe hesitant to take it, or people who for whatever reason just haven't done it yet.
And we'll talk really quickly, and I don't want to spend a lot of time on this, but I do want to address some of these comments about the vaccines. There are no clinics in Alabama that are giving unapproved vaccines. The 3 vaccines that are approved are the Johnson & Johnson vaccine, the Moderna, and the Pfizer. You might also hear Johnson & Johnson vaccine referred to as Janssen. That's the same thing. It's just kind of a dual name, we'll say. Those are all approved, and we are linking here CDC and FDA information, so you can find out more about that, but those are approved vaccines. They are not an under the table vaccine situation. Another comment here I want to address was somebody saying that a business cannot deny them service if they do not, if they do not wear a mask. And that is incorrect. If you are in a business that is requiring you to wear a mask, they are requiring that. And that is, according to the governor, she said that today. That's not my opinion. The governor said they have the authority to do that. And she even encouraged businesses to make their own rules, to use their authority. And she encouraged local governments to get involved as well. Dennis, were you surprised to hear that?
I wouldn't say I was surprised. I think she's all along kind of taken the position that she's going to, require masks in public as long as there's, the health emergency. As our numbers have continued to go down, our case numbers and our number of people vaccinated continues to go up, then she's ready to pull back. And there are a lot of people in Alabama who do not like being told what to do, and Ivey is not going to win a lot of popularity contests by requiring things that aren't really necessary. So I think she's all along would have preferred personal responsibility, but the numbers and the spread and the death caused by this disease just really made that not an option for a long time. But now that things are starting to look better, that we're seeing the light at the end of the tunnel from this, then she's starting to go ahead and move back. I think she'd love to see, a lot, as she said, people still taking precautions and still being cautious and, trying to make sure we don't have another spike, another rash of cases that could kind of force people to rethink some of these things, if we have a huge spike.
Right. Now, Dennis, I'm going to answer some questions, but I want you to do a quick assignment for me while I do that. Somebody asked, what is, I believe it was Edward, saying, what is the most dominant vaccine giving to people in Alabama? And he says he had Pfizer. So if you will do me a favor and look that up while I'm answering some of these questions, Edward will get back to you. Thank you, Dennis. Put on my teacher hat. A comment here from Dana, and Dana says that he has to wait 90 days from when he got his positive test of coronavirus to get his vaccine. And Dana, you're absolutely right. That is what we've heard from professionals all along, that if you have been diagnosed with COVID, you got to wait about 90 days to get your vaccine. Health professionals say that's because you already have a little bit of immunity from getting the virus, and you don't necessarily need that vaccine until 90 days out. Now, question here that I think is very interesting from Juanita. And Juanita says, why does paperwork ask for your race when you fill out paperwork for your vaccine? If all vaccines are the same, why does it matter what race you are? And Juanita, I think that's a great question. And I think a lot of people probably think that. So I appreciate you asking that. And that is because the state of Alabama, and I believe the country as a whole, is recording the equity of those vaccines. And what they mean by that is they want to see how many people in different groups in different areas are getting the vaccines. They want to be able to show that they have provided vaccines to X number of Black people, X number of white people, X number of Hispanic people, and they are using that for their own data, and that is why they're asking. It's the same vaccine, but they just want that for their own personal data. And that also is available on the Alabama Department of Public Health website, I believe. And Dennis, you would know more about that. But that way you can kind of see the breakdown of who has received the vaccine.
Yeah, that's absolutely right. There's a lot of concern about equity, about making sure that the vaccine is getting out to all the different communities, that certain people aren't being left out. And that's why that is required, because we need to make sure that we are getting the vaccine to everyone, not just to the affluent areas, not just to people of a certain race or anything. We need to get it everywhere, and that's just kind of a way to track that and make sure that we're doing it effectively.
Got it. Another quick question. I believe it was from Ann Morgan, and she asked about when the current Safer at Home order expires, and that is Friday at 5 p.m. It is not today at 5 p.m. So state mandate, especially for those masks and for those other rules, goes until Friday, April the 9th, 5 p.m. The Safer Apart part of this order, which starts Friday at, I guess, 5:01, that will go through May the 5th at 5 p.m. So that's that phase we're going to enter. We will remind you of all of that on AL.com and on our social media channels. Dennis, did you complete that homework assignment I gave you?
I did. I finally finished it. It took me a while, but it looks like kind of Pfizer and Moderna are very close in terms of the number of total doses that we've been given. It looks like this is a little bit out of date here, but it looks like about 700,000 for Moderna, a little bit less than that for Pfizer, and then this was from March, but about 20,000 Johnson & Johnson doses. So just a little bit more Moderna than Pfizer, and then Johnson & Johnson is a distant third.
There you go,
because
Edward.
Of course, that one was approved later, so we've only been getting that one for a few weeks.
Absolutely. So, Edward, if you're still with us, we had Moderna just a little bit above Pfizer, and then Johnson & Johnson last. As we know, that reflects the date that Johnson & Johnson vaccine was approved for use. So I know we have a lot of work to do, Dennis. It's going to be a busy day and a busy week for us, but I appreciate you coming on, breaking this down for us, and telling us what we can expect on Friday.
Happy to do it.
Thank you, Dennis. Everybody, thank you for watching. If we didn't get to your question, please send it to us via direct message. Let us know on social media or send us an email, and we will make sure to get it answered. So thank you so much for watching. We'll see you tomorrow.